Cultures all over the world use the same language, words like hurt and pain, to describe both a physical wound and an unwanted breakup. While this seems like a metaphor for an invisible experience, the biological reality is far more literal. Within days of a significant loss, the body begins to manifest a specific constellation of symptoms: a crushing heaviness in the chest, profound brain fog, and muscle aches that feel like the aftermath of a physical struggle. Neuroimaging studies from the University of Michigan explain why. They found that social rejection and physical pain actually share the same somatosensory representations in the brain, activating the same neural circuits. To the nervous system, losing a key attachment figure isn't just a change in social status. It is interpreted as an immediate threat to physical survival. Because of this overlap, the human brain is effectively unable to distinguish between the emotional impact of heartbreak and a violent physical assault, triggering a primal alarm that takes over the entire body. This alarm activates the hypothalamic pituitary adrenal axis, which floods the bloodstream with cortisol and adrenaline to prepare the body for a life-threatening danger. Chronic exposure to this chemical flood can cause physical changes in the brain, shrinking the prefrontal cortex, the region responsible for decision-making and rational thought. At the same time, the amygdala, your brain's emotional fear center, overactivates and enlarges, leaving the mind in a state of hyper-reactive anxiety. As cortisol surges, the bonding chemicals you once shared with a partner, like dopamine and oxytocin, plummet, plunging the nervous system into a state that mirrors clinical addiction withdrawal. This combination of structural brain changes and chemical shifts makes it nearly impossible to regulate emotions logically, leaving the mind trapped in a reactive state of fight or flight. This state of high alert eventually dysregulates the vagus nerve, the pathway your nervous system uses to return the body to a state of rest and calm. Without this signal to rest, resources are diverted away from the digestive system, leading to the nausea, abdominal pain, and gastrointestinal distress common during acute grief. This sustained stress also suppresses the immune system, leaving your body's defenses weakened against actual pathogens. This chart shows the rate of change in interleukin-6, a pro-inflammatory molecule. For bereaved spouses experiencing high grief, there is a massive 45% hourly increase following stress. This systemic inflammation physically damages the cardiovascular system, acting as a causal factor for coronary heart disease. This is the biological reality behind the widowhood effect, where mortality risks for a surviving spouse can increase by up to 90% in the 3 months following a loss. For some, the relentless flood of stress hormones targets the heart muscle itself. In extreme cases, a massive surge of adrenaline can physically stun the left ventricle, the heart's main pumping chamber, causing it to stop contracting effectively. This contrast X-ray shows a healthy left ventricle during its resting phase, known as diastole. Now look at the ventricle of a heart under severe emotional stress during contraction. The lower part of the muscle has ballooned outward into a distinct, distorted shape. This causes intense chest pain and shortness of breath that feels identical to a massive heart attack, even though the coronary arteries remain completely clear. Doctors call this Takotsubo cardiomyopathy, named after the round-bottomed octopus traps used by Japanese fishermen, which mirror the shape of the deformed ventricle. It is a vivid demonstration that invisible grief possesses the physical power to paralyze and reshape a healthy human heart. While Takotsubo can be fatal in rare cases, the central question for most is how the body recovers from such a profound shock. Our bodies are remarkably resilient. As the hormonal surge clears, the stunned heart muscle typically heals and returns to its normal function within 1 to 4 weeks. Understanding heartbreak as a measurable physical injury, rather than a poetic metaphor, changes how we must approach the healing process. The exhaustion and pain of grief require the same literal physical convalescence as recovering from a severe blunt force trauma or major surgery. A broken heart is a state of total systemic dysregulation, an injury that demands the same time, patience, and medical respect as a broken bone to fully heal.